Hello, good morning or good afternoon, wherever you are, and thank you for joining me today. My name's Aneta Gel, and I'm a Quality and Operations Manager at Paul R. Palmer Limited. I have been in the industry for over 25 years, where my journey started on the shop floor in the manufacturing environment and took me through production areas to quality assurance and training where I am today. And today I would like to talk to you about data integrity. And during the next 30 minutes, I want to make data integrity feel practical rather than abstract. We are not going to spend the session memorizing the definitions or the regulatory wording of data integrity. What we're going to do instead is we will look at the way inspectors think and the evidence they use and to decide whether a GMP record can really be trusted. If you have any questions or comments during the session, please put them in the comment section during the webinar, and I will respond to you after the webinar. Okay, so the central question here is very simple. Can we prove what actually happened? And that includes who performed the activity, when it happened, what the original result was, what changed, why it changed, and whether the final decision was scientifically justified. Data integrity is sometimes treated as mainly a laboratory or electronic system topic, but as we know, in reality, it applies to everywhere where you have data that supports a GMP decision. That could be material release, production, cleaning, environmental monitoring, deviations, and then you've got the validation, stability, complaints, and batch disposition. So as we move through the session, keep one record from your own area in mind. This could be a batch record if you're working with batch records, or a logbook, or the analytical results spreadsheet, or an electronic workflow. And we can ask ourselves whether, if someone independent looked at that, could they reconstruct the full story from the evidence that we have available today? Oops, sorry. So let us begin with what matters, why that matters so much. At the heart of data integrity is, of course, the patient protection. Every important pharmaceutical decision rests on evidence here. We release materials because the data tells us that they meet requirements. We control a process because the readings and records tell us it is operating as intended. And we accept a test result because the method, the instrument, the sample preparation, and the review supports that decision. We close an investigation because the evidence supports our conclusion. And eventually we make a batch decision for release or not release. Now imagine the part of that evidence is missing, or it's changed, or it's been recorded late, or it just cannot be reconstructed. The final result may still appear to pass, but the decision becomes unreliable because we no longer know whether the evidence behind it tells the complete story. And this is a very important distinction, because a bad result is not automatically a data integrity failure. A process can genuinely produce an out of specification result and still have excellent data integrity if the result is fully recorded, investigated, and handled correctly. And equally, on the other side, a passing result can have poor integrity if earlier failures were omitted, or if the system allowed the data to be altered without the traceability required. And inspectors are therefore not satisfied simply with a number that is within the specification. They want the confidence in the path that led us to that number. And that information moves us naturally to the simplest and practical definition of data integrity that I want to share with you today. So, as a useful working definition, I would say the data integrity is this. It's a record. There's data integrity or integrity when a competent person can reconstruct what actually happened and trust the decision that was made from it. Okay, it's like in our maths exam that we've been through. They never just want to see the results, how you got to your calculation result. They want to see how you got there. They want to see your working because they want to see the integrity of your working out. Okay, so, and the word reconstruct is very critical here. It means the record must still make sense after the event, not only to the person who performed the work, but to a reviewer, an auditor, or an inspector who was not there. When I work with people and clients on investigations, on root cause analysis, this is a key point that I talk about. Your record, your reconstruction of events needs to make sense even after the event and to other people, not just you. A key point here. So the questions are straightforward. What happened? Who did it? When did it happen? And what changed? Why did it change? And was your final decision justified? And these questions will apply equally to paper and to electronic records. For example, if a value in the batch record was corrected, can we still see the original value? Can we identify who made the correction and when the correction was made? Is the reason for correction clear? If an electronic result was reprocessed, in this case, we want to know, can we see the original result? Can we see the change, the user, the time, and the justification, the scientific justification for the change? Notice here that this definition also covers the unintentional weaknesses, because data integrity is not only about fraud. A poorly designed form, an overloaded workflow, a shared credentials, weak access rights, or a reviewer who can see only a PDF can only make a record unreliable, even when no one's intended to conceal anything. Okay, so the familiar Alcoa Plus principle help us to test whether the record has the qualities needed for that reconstruction of your work, of the event. Oops. Okay. Alcoa Plus is often taught as a list of words, but what inspectors do, they use it as a practical test of trustworthiness. So, attributable means we can identify the person or validated system responsible for the action. Shared accounts immediately weaken that assurance. Legible means the information remains readable and understandable throughout the retention, including unit, meaning, and the context. Contemporaneous means it was recorded when the activity occurred. So the timestamps should agree with the equipment logs, access records, and other evidence. Then we have original. Original means the first capture or a verified true copy that preserves the content and the meaning, and that is retained. Accurate. Accurate means the record correctly represents the observation, including the calculations, the transcription, any processing, or any rounding. And the plus element is just as important now. Complete means we retain the failures, we retain the repeat, the invalidated results, the changes, and the context behind it, and not only the result that we ultimately report. Excuse me. Consistent means the chronology and the sequence make sense. That is very important, because if you don't set your chronology correct at the beginning, when you're reviewing that record or someone else reviews it in time, the chronology is what makes us understand. And if it's not there, then it's difficult to understand what happened and when. Enduring means the information sits on a controlled and durable medium rather than a loose piece of paper or temporary files or unsupported local storage. And available, that means that it can be retrieved promptly and rendered readable throughout its retention period. Often inspectors will ask for documents to be retrieved, and when they are retrieved, they are not in a readable format anymore, and then they are not really useful. So the practical translation is not, can the employee recite Alcoa Plus? The practical translation is, can this record still be trusted later? Okay, and the answer, and to answer that question properly, we need more than the reported value itself, and that where the reconstruction of the events is important. So, as I've already started kind of talking about it, the result alone is rarely the complete GMP record, as we know. Think of an assay result of 99.2%. The number is the data content, but it doesn't tell us who generated it, how it was acquired, and which instrument and method were used to acquire this data, which samples were tested, or whether the results had to be reprocessed. So the surrounding information around this is very important, and it's called the metadata. With the metadata, and then we have the audit trail, which may show the methods changes. It can show the reprocessing, the sequence edits, or even the attempts to delete or any other user actions. We also need the scientific context. What we mean by that in our assay result, we mean the system suitability, the calibration status, the sample preparation and calculations. And then we need evidence of review. So who reviewed it, when, what exceptions were considered, and what conclusions were reached. And then finally, we need a decision that the whole evidence package supported. And this is why, excuse me, a static printout or PDF may not always be enough. A fixed report can show the final chromatogram, but not necessarily the processing history, the sequence structure, the integration changes, or the deleted records. Where the meaning of the activity depends on interactive functionality or processing history, the dynamic electronic records must remain available. So the inspector does not simply ask you where is the result. The inspector will ask where is the complete record and the context needed to understand this. And that leads directly into how they test the evidence in practice when they come to your site. So inspectors generally test around 7 connected propositions. Okay, they start with the first one, which was the approved process followed? That's where they start. They compare the SOP or the method with the work that was actually performed. Then they move on to the second one. Does the chronology make sense? They may compare record times with system clocks, door access, equipment logs, or biometric records. Then the third test would be were all relevant data retained, including the failures, the repeats, or any aborted sequences and invalidated results. A fourth test would be, can every meaningful change be attributed and explained? And the fifth one, are access controls strong enough that the record cannot be undermined by shared accounts, excessive privileges, or uncontrolled administrators? The sixth test would be to qualify whether the review is deep enough. A review signature alone is not evidence of an effective review if the reviewer did not use the source data or the relevant audit trail. So they want to see the evidence of that, the depth of the review. And the seventh test is, did management respond appropriately when adverse information became known? The inspection trail normally moves from approved procedure to the source data, then to metadata and audit trails, the review, and the final decision. And the inspectors cross-check these sources rather than accepting each document in isolation. When the records agree, confidence increases. When the records start to conflict, the scope of your inspection, of the inspector, what they are looking at, will start to expand. And if you experience that, you can see that that they start to dig more. That means they are not happy with the responses that they've been provided up to that point. Timestamp discrepancy may lead to a broader look at the user access, review practices, investigations, and management oversight, and other products or systems. So knowing this inspection pathway helps us understand why some apparently small weaknesses will trigger a much deeper inspection. Some red flags repeatedly attract the attention because they show that the process may permit information to be lost, changed, or created after the event. So in paper and hybrid systems, inspectors notice the uncontrolled blank forms, delayed entries, unexplained empty spaces, overwritten information, and scanning processes that don't reconcile the paper original with the electronic copy. And the paper records need preventive and detective controls, just as electronic records do. So controlled issuance, the page numbering, and reconciliation will provide the adequate or equivalent traceability that is needed. In electronic system, the common concerns include shared accounts. Believe it or not, this still happens. Analysts with administrator rights, deleted source files, disabled audit trails, also something that still happens, and unexplained gaps in your system activity. These weaknesses do not prove misconduct, but they create the opportunity for undetectable change and therefore reduce trust, and therefore the inspector will start looking much deeper. Another point about electronic systems is the backup process. If you've never tested your backup process, you've never tested whether your document, once it's retrieved, is readable, and then it's tested during the inspection, the inspector will see it as a weakness, as a gap, and will start looking at your overall electronic system management. The third group of red flags here relates to a review and the overall company or site culture. So repeatedly blaming the human error, responding only with retraining, setting a target to 0 reported concerns, or failing to escalate known issues can signal that the organization is treating symptoms rather than the causes. And as we know, human errors, there's always a reason why the human error has occurred, and that reason needs to be investigated rather than just put to human error and retraining. Because if your SOP is not correct, retraining is not going to really solve your problem. The key point here is that red flags rarely remain isolated. A shared password can become a question about the access governance. A missing file can become a question about a backup, retention, and the retrospective impact that that has. Repeated late entries can become a question about the workload, the process design, and supervision. So a useful way to make this practical is to compare, for example, a pharmaceutical manufacturer of a primary packaging with a primary packaging supplier, because the principles are the same, but the evidence trails that the inspectors will look at will be slightly different. So for a direct manufacturer, the site, the inspectors will often focus on the batch records, the laboratory raw data, your out of specification investigations, your audit trails, your product release, and whether the unreliable information affected a specific medicine or a patient decision. When it comes to suppliers, like primary packaging suppliers, the questions are usually more about whether the pharmaceutical customer can rely on the supplier's evidence of the material conformity and the process consistency. Inspectors may look at the manufacturing specifics and the records associated with the manufacture of that primary packaging material. The traceability between raw materials, the molds, the production lots, any inspection results and certificates, and whether failed or repeated or preliminary results have been retained or just quietly filtered out and kind of lost. Automated inspection equipment is another good example. So the certificate may say the lot passed, but an inspector may ask whether the inspection recipe is controlled, whether acceptance parameters were changed, or whether rejected containers and defects were trended, and whether the certificate reflects the complete underlying evidence. So the difference is not that the primary packaging suppliers have lower standards to your manufacturer. The difference is that the risks with the primary packaging supplier and manufacturer, that the risk sits in different, slightly different places. In the medicine manufacturer, the data integrity concern may be directly linked to a batch decision. In a primary packaging supplier, it is linked to whether the customer can genuinely trust the certificate, the traceability, the change control, and the process history behind the packaging component. And I've talked about that in one of my previous webinars, where how we manage suppliers. And we do also provide training on our Academy of Pharmaceutical Excellence site. So please do have a look at that if this is something that interests you. So a simple question for suppliers is, can we reconstruct exactly how this lot was produced, inspected, accepted and certified, including any failures, repeats or any changes? And if the answer depends mainly on trusting the certificate rather than tracing the evidence behind it, and this is where the inspector will likely to start probing and looking more in depth. One area where inspectors expect particularly meaningful reviews, as we all know nowadays, is the audit trail. So, audit trail review is not a mechanical exercise where someone confirms that an audit trail exists and then they sign the box. Or it shouldn't be like that if it is like that. The purpose is to determine whether the actions affecting the data were authorized, whether they were scientifically justified, complete, and reflected properly in the final GMP decision. A sensible review starts by defining the scope, which record, system, or period is being reviewed. What does my audit trail review cover? And which events could affect identity, result, method, sequence, approval, or retention. Then you want to confirm that the audit trail is enabled, protected, that it's time synchronized, and that it's readable. And then the reviewer is independent and competent where practicable. Then you've got the reconstruction or the chronology. So you compare electronic events with the worksheet, the logbooks, instrument use, and deviations. In the sequence, physically and procedurally, is this possible? Is the sequence that we see physically possible? They will look at the critical events such as deletions, reprocessing, your aborted runs, sample ID changes, or method changes, and any changes to the privileges. So the event needs classification. An expected event is a routine and it's authorized. An explainable exception is unusual, but it will be supported by contemporaneous evidence, such as a document power failure. A critical event could alter, omit, or misattribute the data. So a systemic signal is a pattern that points to a wider process or governance weakness. And finally, assess impact and escalate where required. Ask whether the GMP decision would have changed if the event had been known. And this is the depth of review that inspectors expect in audit trail review. And it also shows why a root cause cannot stop at the individual action. So when you find an integrity weakness, for example, the analyst did not follow the SOP, is usually only a description of what happened. It doesn't explain why the event was possible, why it was not detected, or why it might happen elsewhere. The useful root cause addresses all these three questions. Why could it happen? Perhaps the system gave routine users deletion rights. The procedure permitted unofficial testing. The form design encouraged late transcription, or the workflow was too difficult to perform correctly under a normal workload. Why was it not detected? Another question. Perhaps reviewers saw only printed reports. Audit trails were not accessible. Exceptions were not trended. Or responsibilities between quality assurance, IT, the system owner, and the process owner are unclear. Why could this recur elsewhere? So the same role design, supplier configuration, workload pressure, or incentive, structure, or even the management culture may exist across other systems, other laboratories. That's why it can recur somewhere else. And that should change then your CAPA response. So revising the SOP and retraining the person may be part of the action, but it's rarely enough to stop it recurring and recurring somewhere else. Stronger CAPA may require role redesign, technical restrictions, better review accesses, changes to system suitability, having independent administration, retrospective reviews, and clearer governance. And of course, the most important part about any CAPA is having a measurable effectiveness check. So once you've set up your CAPA, you go back and you have a measurable effectiveness where you will have a look whether your CAPA has worked. This is a real focus in the last year or so, is on the effectiveness checks of CAPA. And the aim is to change the conditions that made the failure possible. The aim of your CAPA, isn't it? Not only the behavior of the person who happened to be present at that particular time. So this system view is becoming even more and more important as GMP data move into cloud services, connected systems, and AI-supported workflows. And we do have training on CAPAs, how to set good, strong CAPAs and effectiveness checks on our Academy of Pharmaceutical Excellence website. Okay, so current and emerging inspection themes. They show a clear shift from isolated record defects towards a life cycle governance and digital resilience. For cloud services and outsourced systems, the accountability remains with the regulated company. Signing a contract doesn't transfer your GMP responsibility onto your provider. The responsibility stays with you. Individual responsibilities need to be documented in your contract, in your quality agreement. So your organization still needs to understand the data ownership, the locations, the accesses, what's the backup, restoration. So all that needs to be arranged. It needs to be documented, and it needs to be agreed and approved by both parties. Cybersecurity is also a data integrity issue. Ransomware, compromised accounts, insecure remote access, or unpatched system can make a GMP record unavailable or unreliable. I myself have experienced a cyber attack on a laboratory where I worked at the time, and it is not a pleasant time. Confidentiality matters, but from a GMP perspective, the essential questions are whether the data remains accurate, protected, and retrievable when needed. AI and machine learning tools add further questions to this. What's the intended use? Where did the training data come from? Which model version produced the output? How is a drift monitored? What human review is applied? And what evidence is retained to reconstruct the decisions? In the EU, in revised Chapter 4 and Annex 11 and the proposed Annex 2022, Annex 22, an artificial intelligence will be included. Okay, and they obviously Annex 22 is in a draft, but it indicates a regulatory direction because the artificial intelligence is here to stay, and we will be using it more and more. So we should prepare for the direction of travel, but without you know, and being ready when these things come in. And across all these themes, the same principle remains. Trustworthy decisions require control data throughout the full life cycle. And that will bring us together into 5 practical takeaways that you can take with you at the end of this webinar. And they are the 5 points that I would like to summarize today's webinar into. The first one, trustworthy data means reconstructible decisions. Do not ask whether the final value is correct. Ask whether the evidence allows an independent person to understand the full activity. Second takeaway is that inspectors test the evidence trails, not the isolated records. They compare procedures, timestamps, source data, metadata, accesses, audit trails, and all the reviews and final decisions to make an assessment whether your data and your records are trustworthy. Third, complete data include the uncomfortable information as well as the favorable information. So you want to have the failed runs, you want to have the repeated tests, the invalidated results, you want it all there, visible and in your as part of your data. The fourth takeaway for today, I would like it to be that audit trail review requires context and a risk-based judgment, not just something that someone will tick as a tick box exercise and sign it as done. It's not enough to search for words such as delete or confirm that the function is switched on. The reviewer must understand what happened, why it happened, and whether that whatever happened has affected the GMP decision. The fifth takeaway is a credible CAPA addresses systems, access, review, and governance. Retraining alone will not fix a process that make the wrong actions easy, invisible, or even necessary to complete the work. So if you take this away from today, if you're looking at CAPAs, if you are thinking about putting down that you're going to retrain, stop and think, is this going to fix my issue? The useful action after today is to choose one critical record from your area and try to reconstruct the complete story. Can you move from the approved procedure through to source data and metadata to the review and a final decision without any gaps and any contradictions? Once you point out any point where the story breaks, that is the valuable place where you can put a stronger control. And that today brings us to the end of the webinar and back to the main message. So data integrity is not achieved by asking people to be perfect. It is achieved by designing processes, systems, workloads, review controls, and governance so that doing the right thing is practical, mistakes are visible, and changes are traceable, and the concerns can be raised safely. So the question to keep on the agenda is, can we prove what actually happened and trust the decision that followed? Thank you very much for your time today, for joining me on this webinar. I hope you found this session useful, and it has given you the inspector perspective, and it made it clearer and has given you some practical ways to look how to improve your records in your own area. If you would like to talk about more about specific topics, please do feel free to contact me directly, or have a look at the Academy of Pharmaceutical Excellence contact details that I have provided on the first slide and at this last slide. Thank you very much. Have a lovely rest of the day, and I hope to speak to you soon. Thank you. Bye bye.